Hi, I'm Lynn Bornfriend. I am a psychiatrist who is speaking today about de-prescribing from pharmaceuticals using medical cannabis. So in psychiatry, the joke is if it's not one thing, it's your mother. So my story does start with my mother, but before I get to that, let me go back a little bit. I was no fun in high school, college, my 20s. I have never taken a puff of a cigarette, and I believed everything that I had been told. Cannabis was a gateway drug, and it was terrible, and oh my gosh, don't get near it, and all of that stuff. As I proceeded in my medical career, it just got more and more concrete, maybe. About 10 years ago, I started working at a cancer hospital for people with advanced and late-stage cancers. And it was a hospital that characterized or prided itself on being very interested in self-empowerment, which is, as you imagine, really important in cancer treatment. People to tell you what felt right for them, what didn't, what resonated. I knew several of my patients were using medical cannabis, and I was not argumentative, but I didn't really feel it. I didn't get it. About, I guess, 8 years ago, my mother, who was 84, but in perfect health, not a single diagnosis, not a single medication she took every day, was all of a sudden diagnosed with stage 4 lung cancer. And this was someone who had never smoked, no chemical exposures. My older sister, who was a bit of a hippie, said, let's use medical cannabis. And my response, which comes from that place that I guess it's the course in self-righteousness and condescension that they teach in medical school, but was absolutely not. I'm a licensed professional. I say that over and over again. It's kind of my penance. But anyway, my mother had been a high school teacher. Her response was, I'm not doing that. This is what bad kids do. So my mother started her treatment, and it was good. The tumors were shrinking, but my mother was a very petite, tiny person. The chemotherapy gave her nothing but nausea and vomiting. She was very conscientious. She would eat anyway. When she ate anyway, cramping, gas, horrible pain, diarrhea, all the kinds of things you really like to talk about when it's approaching the dinner hour. Anyway, she had very poor tolerance, was not able to eat. About 8 months into this, she was pretty much done. She had gotten so cachectic and skinny. And they said, that's it, we're done. It's time for hospice. At that point, my older sister said, the hell with both of you, and came with a cannabis edible. I heard about this, and I raced to the scene, on my white steed. I was like, oh my God. Got there, and was kind of taken back. My mother was sitting up. She was not in pain. She was not nauseated. She was not anxious. She was not high. And she was eating a little bit. It was too late for my 84-year-old mother, but that was my game changer. Since that time, the hospital where I worked, which was very interested in integrative services, I had the opportunity to deal with a lot of people and talk about a lot of different medical conditions. And got to see over and over again the incredible ways that cannabis was able to change people's physical health. I used to have a wonderful condition, a poster from a company called Leafly. The different conditions, and underneath each named condition, they would have different cannabinoids that were helpful. And I would keep this poster in my office, and people would come in, and I'd show them the poster, and they'd say, me, 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 me. And it was amazing. People would come back in a couple weeks, a month, and they would say to me, I'd say, how are things going? Well, I no longer take the Ambien for sleep. I don't take the breakthrough pain meds anymore. I don't need the nausea medication. It's pretty exciting. My story about cannabis and de-prescribing is made of faces. So we started with mother's face. My mother was an educator. She was taught in high school, and when I get very excited and explain to people about cannabis, they say, oh, you're so passionate about this. I said, you know what, I'm honoring this woman that I love, because I feel very strongly about that. But it's not just my mom. So another face is that of my daughter. My daughter is adopted from China at 10 months. When she was 10 years old, it was a week after my mother's death, she was diagnosed with an autoimmune kidney disorder called IgA nephropathy. It's genetic. And a third of the people diagnosed have one episode, you never see it again. A third of the people have a waxing and waning course. A third of the people rapidly progress to dialysis and death. They treated her with steroids, massive doses of steroids. And in my little 10-year-old, beautiful little child, very quickly began to look like the state of the Marshmallow Man. You know, just bloated and all the things that happen with steroids, the emotional dysregulation, she couldn't sleep. And in 2 o'clock in the morning, I'd hear in the kitchen she'd eat an entire chicken or something like that. It was crazy. Once it dealt with her symptoms, she took months and months for the side effects to resolve. Flash forward 4 years, and we're in her kidney doctor's office, and he says, oh boy, the numbers are changing. We need to start the medicines. My then 14-year-old burst into tears. Please, that to me. I said, give me a month. At 14, I wasn't going to use THC, but I used very high-quality CBD. My daughter will be 18 in a few weeks. She has never taken steroids again. The last time we were at her kidney doctor, they asked her to be in a bone study. We went in to talk to the young woman doing the study. She said, well, because of your steroid use, you have osteoporosis. You're going to have fractures. I said, stop. She doesn't take steroids. She doesn't have osteoporosis. As a matter of fact, she's a varsity and travel team athlete, and perhaps you should be studying the effects of CBD in bone health rather than steroids. Here's my other face. I'm a dog lover. I had a beautiful golden doodle. Standard, big guy. About 2.5, he developed what the doggy version of Crohn's disease, autoimmune. $6 million later, the surgeries, the everything like that. So here the dog is now 10 years old. Large dogs, 10 years old, their hips start to go. The pain medicine they use for animals is like Megamotrin. There's no way he could have taken that. I've been babying him through his whole life. You looked at him funny when he had colitis. So CBD. Not only did it help with his doggy Crohn's, but it helped with his irritable bowel. I'm sorry, that was his doggy Crohn's. His hip pain. He lived for 3.5 more years. Patients coming into my office who had cancer, they had lymphoma. Oh yes, I have psoriasis. I was treated with Humira. You know those commercials, may cause. Sure, in fact, does cause. And instead, autoimmune disorders, psychiatric disorders. As a psychiatrist, I no longer reach for my prescription pad for depression, for anxiety, for insomnia. I'm saying, let's go to cannabis first. Let's talk about cannabis first. Let's exhaust cannabis first. PTSD. I do a lot of work with veterans organizations, and a colleague of mine has a film that's screening on Amazon Prime now for free called Unprescribed. It's talking about, from the veterans' perspective, the fact that all these guys came and women came home from war with both psychiatric and physical illnesses, and the VA didn't quite know what to do with them, and so they were given dozens and dozens of prescriptions, and it wasn't whether or not people became suicidal, it was how many times they attempted suicide, and how cannabis was an escape, and from that cycle, and now even more so, psychedelic and plant medicine is taking it the next direction. There are neuropathy. Peripheral neuropathy is the numbness, burning, and tingling that people get in their extremities sometimes. It's connected to 3 basic things. It's connected to diabetes, a side effect of long-term diabetes. It's connected to nerve damage. People who had a destroyed nerve might end up with this numbness and tingling. It's connected to chemotherapy. And I would have psych consults at the cancer hospital, people who were depressed or anxious who couldn't sleep. When we got down to it, it was because I have this constant burning pain. I can't rest at night. I can't sleep. Cannabis topically. You can put topical cannabis all over your entire body. It doesn't go to your brain. But topically, I keep a little pot of it in my in my office. It was shea butter, coconut oil, grapeseed oil. It's actually the people Be Pain Free or upstairs. That's where I had purchased it from them. CBD and THC oils. It was full spectrum, actually. So scoop some out and say, try it. You can put it on your fingers and toes. They say, oh, I'll just put it on my hands. About 5 minutes later, I'd see people going, ripping their socks off and saying, give me that. Amazing. 4 to 6 hours, and then you reapply. If it doesn't work, the worst thing that happens is you're beautifully moisturized. People with diabetes, lowering their blood sugar. You know, the issue of munchies has a lot to do with the drop in blood sugar. And so in diabetics, people are able to better stabilize their blood sugar. I had a patient who came in for treatment of a melanoma, and it was especially traumatic for her because her child had died at 17, I believe, of a melanoma. Her blood pressure was through the roof. Got her started on the RSO oil that we use for cancer patients as well. And I saw her a few months later, and she said, you know what? All through this whole treatment, my surgery and everything, my blood pressure's been 110/70. My doctors can't figure it out. That would be cannabis. The roots of its cannabis prohibition, I believe, come a lot from the fact that it is so powerfully effective. Our grandmothers, our great-grandmothers, those generations where we had all these folk remedies, maybe great-great-grandmothers. Come on, I'm making us a little older than we are. But there was a lot of cannabis used at that point. And then the 1920s come along, and it's the Industrial Revolution, and people no longer want you to buy or use your grandmother's medicine. They want you to purchase the shiny white pills rolling off the conveyor belt. So the story is, oh my God, that stuff is dirty, it's not good for you, it's garbage. And then we throw in a little racism, because what's our country without a little racism thrown in? So the headlines that marijuana, which was a constructed word, the plant is cannabis, sativa, but the marijuana made it sound Mexican. And the headline was that marijuana and jazz music will make white women run off with men of color. That was probably not the words they used to describe the men. But yes, so in order to save our women folk, we need to ban this horrible weed plant growing. Today, the racism comes and greed come to the same level. The top 4 industries that are arguing against legalization, number 1, big pharma. Gee, I wonder why. Number 2 and 3, big alcohol and tobacco. That's because they care about your health. And the number 4 industry is the private prison industry, because of all of those people who are serving life in prison for selling a dime bag. And weren't they coincidentally people of color? You know, white kids didn't go to prison for life for selling a dime bag. And so here we are. The private prison industry is getting paid over $800 per body per day, and they don't want to lose that money, so they're arguing against legalization. So my mother, who I adored, suffered and died because of those people, the greed, the racism. I'm done. No more. That was my change. At this point, I wonder, whenever I see a new medical condition, how might cannabis help with this? Inflammation is the number 1 cause of disease in aging. Think about it. You know, in an arthritic joint, there's inflammation, the area gets swollen, there's destruction of the tissue, it's painful, and it's a vicious cycle. Except that you add cannabis, and CBD itself is, I believe, 30 times as anti-inflammatory as aspirin. So you add cannabis, and not only is it helping with the stiffness or the pain, but it's preventing the further deterioration. From a cancer perspective, mutations come from inflammation, disruption. And that's what leads to cells growing out of control. So if you can prevent inflammation, think about it in terms of autoimmune disorders and the destructiveness that happens to the organs. Over time, the scarring, the breakdown, controlling inflammation. I know I'm stepping out of line. I guess I can't prove it, but I wonder why Big Pharma doesn't know that much. The statistics about the states where cannabis is fully legal and the number of prescriptions that are not written and the impact on opiate deaths in those states. I come from Pennsylvania. We're medical, but we're not recreational yet. And that's a little better, but not quite as good. Another, you might think, gosh, as a doctor, she sure hates doctors. I hate some things about doctors. As a psychiatrist, I knew a lot about detoxing from drugs, opiates. The methadone and then after that Suboxone were initially intended for a taper. But then there was an interesting little twist where if you're on Suboxone or methadone and you have to go dose with methadone every day, or Suboxone you have to acquire your medication every week, the practitioners are getting paid. And Suboxone treatment is cash, often. And so some of my less ethical colleagues said, you know what, you can stay on your Suboxone forever. You'll just be coming to see me every week for the rest of your forever, and you'll be paying me however many hundreds of dollars. And we're not getting people off these toxic, horrible medications that control their lives and damage their livers and damage their psyches and everything else. And then I talked to people who have used cannabis and got off their Suboxone or methadone. Those are very daunting medications to get off of. People are terrified. My God, what if I relapse back on heroin? I'm stupid. Except that cannabis has helped them to do that as well. My study of cannabis is what led me to plant medicine, which is just the next level of wonderfulness, in my opinion. Understanding the impact of PTSD as a reflex, where your body has experienced a trauma so many times that it might say, wow, I know what to do. Let's say it's a soldier, and every time there were loud noises or chopper noises, there were horrible traumatic things happening. So now this soldier is back in regular every day, and every time there's a loud noise or a chopper noise, this person is is triggered PTSD. Your body is thinking it's being helpful. Your brain is saying, oh, last time this happened, we did this, so I'm going to just start that reflex for you. And a lot of times that's why PTSD was so intractable. People would say, I understand, but I can't do anything about it. That's what happens. It just happens to me that way. And so the psychedelics have also stepped in. Cannabis was marvelous. I described to people, wait, it's a show and tell. This is PTSD. Well, it's hard to go very much this way. You can't think about much because you can't breathe and you can't think about it. Cannabis is the dissociative quality. Peels it off of you. And with your trigger right here, you have the ability to be curious about it, wonder about it, explore it. Am I really responding to what's happening right now, or is it reminding me of something from my past? Is this mechanism of how I'm responding useful to me, or do I want to do something different? And so the dissociative space that cannabis gives is even more beautifully strengthened in a true psychedelic experience. Cannabis is considered a minor psychedelic, but something like a lot of the soldiers I've worked with are dealing with ayahuasca or psilocybin or things like that. The absolute ability to distance yourself and look at your triggers with wonder and the question of whether you wanted to continue your pattern or not. All of these different areas, this plant is so miraculous. There's so many medications that you take too much of them and, oh boy, you're done. The lethal dose of Tylenol is way lower than what you would think. 15 extra strength Tylenol. 7.5 grams is the liver killing dose of Tylenol. I'm a child and adolescent psychiatrist as well. How many kids have said, ooh, I want to make a suicide gesture. I want to show everyone how unhappy I am, that I'm not allowed to do X or Y. I'm going to take a few Tylenol and I'm going to tell oops, 15 of them, 16 of them, be a lot more serious than what was intended. Just about every pharmaceutical we have will kill you if you take too much of it, except for cannabis. It can't hurt you. Pretty amazing. I tease people, I say, if I gave you a tractor trailer full, you would be high as hell. You might eat everything that wasn't nailed down, and you might sleep so heavily that I could draw a picture on your face without waking you. But your heart, your lungs, your liver, your kidneys are going to be fine. When you awaken from your sleep, let's say, there is no headache, there's no nausea, there's no feeling like a thought over. It was miraculous. As I started my little old ladies in the cancer, once I talked them into it, I started them on tiny doses of medicine, and there would be an occasional time where someone took a little bit too much THC. So the first thing I would tell them is, don't panic, it can't hurt you. The second thing is, the natural antidote is in the plant. Take some high-quality CBD, eat something, drink some water, take a warm shower, take a nap. You're going to be fine. In contrast to taking too much opiate, where if you feel short of breath and everything, don't take a nap. It might be the last one you ever take. So here we have this miraculous plant. It has so much impact on so many different areas. How can the same thing be helpful in fighting cancer that's also helpful in treating pain, that's also helpful in anxiety and post-traumatic stress, that's also helpful with GI upset and other autoimmune disorders? And have I mentioned Alzheimer's, which has an autoimmune component, and muscular dystrophy, and on and on and on. It's pretty miraculous. So here we are at this wonderful stage where it was delightful to me to go to a reception last night and have THC included products in our reception bag. You can't do that in Pennsylvania. You can only do CBD. Oh my goodness, no, no, no. But aren't we going in the right direction? And along those lines, I guess there's some things, although I was going to say there's some things that cannabis is not going to be on my first choice for. Someone has a raging bacterial infection, I don't know. Although, with the topical, during the pandemic when we were all washing our hands, and washing our hands and washing our hands and washing our hands, you get those little cuts in your hand, and they hurt. Like a paper cut. And then they can get infected, and they hurt even more. So when I would scoop out the little thing from my patients with the little plastic knife, I take the rest and I put it on my hands. If I had any cuts, number one, they didn't hurt as much. Number two, they kept the inflammation down. And my favorite part, number three, it's antimicrobial. Prevented the infection. So when I had spinal fusion surgery last November. And I was in the hospital. And I don't do well with opiates. They make me vomit. They don't last very long in me. They make me itch. And when I thought about it, my fusion was down here. They make everyone constipated. So the idea of either straining to poop with a lower back incision or throwing up, I was like, the last thing I wanted to do. So I smuggled in my RSO oils. I told my surgeon, but obviously no one can dose you in a hospital. So I took it in myself, and that's when they said, okay, you can use your button on the morphine pump. I didn't use the button. I took my cannabis oils. As soon as my incision was closed at all, I started putting the topical on it. It helped with local pain, it helped with inflammation, and also helped prevent infection. I've had surgery previously where my wound did get infected. It was ugly. So this is some really important, serious intervention that's available in such a non-toxic way. And I guess one of the biggest sources of distress to me was the recognition that this industry that I dedicated my entire life to, go to school forever. You invest yourself, once you finish school and training, you can't really take big, long vacations because you have a practice and you have to be working all the time. And when I realized that the medical industrial complex is invested in our remaining sick, and that illness works, I'm kind of heartbroken. You know, it was never my intention to keep people ill when I wrote the hundreds and hundreds of prescriptions for antidepressants that I wrote in the past, and the antipsychotics that I wrote, and the mood stabilizers. I didn't write a lot of anti-anxiety medicine because we already knew that wasn't a good idea, but the hypnotics for... I felt like I had contributed to a problem that I didn't want to be part of. And it's heartbreaking. And I don't think my colleagues and I were, maybe some of those people who were saying, yeah, keep coming back for the Suboxone every week, you need to, maybe they had a little bit of a twist to them. But it certainly was not my intention, and yet it was part of the process. And breaking away from that, I was teased mercilessly. My colleagues at the hospital called me Dr. Weed and Dr. Doobie. Which was hilarious because they're all talking about, I used to smoke, but of course that was in college. And I was like, oh yeah, well, I didn't. I was no fun.
You had mentioned earlier.
So, I don't know if there are any particular questions anyone has, but I can go on and on. But okay, so the little old lady comes into my office. She says, doctor, I need you to give me a sleeping pill. And I'm looking, and she's on oxycodone, she's on Ativan for nausea, and I was like, she's going to freaking die if I give her another respiratory suppressant. Have you considered cannabis? Oh, honey, I'm not like you. I don't do that kind of thing. And it was said warmly. I said, wait a minute. I'm not like me. Let me tell you how little fun I was growing up. Then I tell them I didn't touch anything. I was so obnoxious that if someone smoked around me, it's not only that I said no thank you, I would run screaming practically. I tell them the story, and then I tell them about my mom. And then I tell them about Sharon, who came into my office with massive doses of Dilaudid, long-acting Dilaudid for her pain from her metastatic bone lesions, and Ativan for anxiety and nausea, and gabapentin for nerve pain, and how when we got her on a cannabis card, the next time I saw her, she was completely off the Ativan. That had been 4 milligrams a day. She was no longer taking the breakthrough oxycodone, which had been 20 milligrams every 4 hours, including awakening from sleep. She had cut the Dilaudid out, but was taking a much smaller dose of a comparable thing. And my favorite part was she got on an airplane. She could not walk. She was wheelchair bound, but she got on an airplane and went and visited her daughter in San Diego from New Jersey because her spirits and her sense of joy and satisfaction had. I tell the story, I put the faces on, and at the end of the conversation, the little old ladies, and then I let them try the topical, let's say, and the little old ladies are now saying, I want this now. Get it for me today. So it is a lot about using my degree and saying, listen, she's going to get me with a hook and drag me right up. But using my degree and saying, listen, I'm a doctor. I come from a different spot. I understand your concerns. Let me give you the reality. Let me give you the reality about prohibition. When people understand that, they're kind of like, wait a minute, they did this for what reason? And those things together, I think, have been really compelling. It is very difficult.
What about the doctors you talked to about it?
So a lot of them said, oh, there's no evidence-based science. Yeah, there's no evidence-based science because cannabis is Schedule 1. No medical use, except that Marinol, which is synthetic THC, has been legal since 1985. And it doesn't work well. That's THC. So there's no medical indication or usage for cannabis, they say, and it's highly, highly addictive, which it's not. Now, benzodiazepines, Valium, Xanax, they're not Schedule 1. As the person said earlier, cigarettes should be Schedule 1. There is no medical indication. There is nothing but addictiveness. So we have to educate ourselves. And some of the people are just like, yeah, honey, I'm out of here. But a lot of them were not. And maybe it's because it was a cancer hospital. Maybe it was because people were that desperate to look for something, that they were more receptive. The elderly can actually be a really good population. I have this wonderful cartoon, and she's getting her hook, I can tell. But the cartoon shows this little old lady. She looks like a Sicilian widow. all in black, and she has a pistol. And it says, when the government comes for your medical marijuana, but you ain't going back to opiates. Tell an old person that they're not going to be constipated from the medicine, and it's going to help them sleep, help their appetite. See if you can pry it away from them then.
Speaking of old people, does the topical work on arthritis?
Yes. Topicals work nicely on arthritis. They're not going through a very meaty area. But bony areas, I have arthritis in my thumb from a mishap in my 20s. And I can put it on, and about 5 or 10 minutes later, yes.
Can you get it just online, topical cannabis?
Be pain-free upstairs, I know. I'm sure most people who are shipping will ship you topical. And as I said earlier, it's really nice to know it's not going to your brain. So you can put it all over and not worry about dizziness or altered sense, mental status. Wonderful. Thank you. And thanks for your patience in hanging around.